So, about 20% of all cancers are due to some sort of inflammatory process. A lot of these occur in patients, for example, who have hepatitis. It's chronic inflammation of the liver, and they have a huge increase in their risk for getting liver cancer. Patients with Helicobacter infection of their stomach have a significant increase for gastric cancer. And patients with inflammatory bowel disease, which is a chronic condition in the colon, have a significant increase in their risk for colorectal cancer. So we've long been interested in trying to understand the connections between inflammation and cancer on the molecular level and really understand the mechanisms for those increases. So this study is one example where we've actually been able to identify a clear connection between this pro-inflammatory mediator, which is prostaglandin E2. It's been studied for several decades. It's expressed at high levels at sites of inflammation where immune cells are aggregating. And mechanisms related to epigenetic changes in the DNA that lead to silencing of tumor suppressor genes and DNA repair enzymes. So when we treat either cells or animals with PGE2, there's a significant increase in the methylation of promoters of these genes that lead to decreased expression of the tumor suppressor or the DNA repair pathway. And when we reverse that by either inhibiting the production of prostaglandins with a non-steroidal drug like celecoxib or inhibitions of the methyltransferase enzymes, azacitidine, it reverses those effects and we see a decrease in tumor burden. So we've been able to tie all those ends together, find this mechanism, and the applicability here is that for the future, in patients who are at extremely high risk for developing colorectal cancer, we can look in that population and see if treatment with these agents would indeed decrease their risk for or incidence of colorectal cancer.